Picosecond. If you have any questions as she's going through, please do drop them in the Q&A box. We do have someone there moderating and fielding the questions, so I will jump back on at the end to ask them. And if you're ready, Sherina, I will go and hand over to you.
Wonderful. Thank you so much, Georgia. And good afternoon, ladies and gentlemen, and welcome to my presentation here at Aesthetic Medicine Live, virtually. Firstly, I would like to thank you for your time and joining me today here. And it's really important that we take this opportunity of time here and now to stay safe, stay well. And on that note, I really hope you are. And also to be mindful of the opportunity that we have to focus on our self-education, continue with professional development. And it's times like this that we have the opportunity to do so. So on that note, I would like to thank Cynosure for the opportunity to present to you today on a topic that is very close to my heart, which is skin revitalization. And I would like to talk about how and when and how I've introduced Picosecond technology into the clinic and how we use it today. I will just bring my slides up. And if any of you can't see them, please leave a comment and we can do that. Make it nice and clear for you. So a little bit of background about myself. My original background and career was in reconstructive plastic surgery and burns in the NHS. So yes, I am a former surgeon and I'm a person of the scalpel. So it's very interesting how that entire transition has now led me to a complete career in non-surgical medicine. I guess the topic is why and how, and it really was a fascination with technology. I'd taken a step out of my surgical training to embark in a period of research at the University College London in the National Medical Laser Centre. I was curious about energy-based devices, lasers in particular, to see how they could cure and treat cancers. And it was during that point the laser knowledge really got the best of me. And you could say that I saw the light and I wanted to know more. I loved my present, which was at that time in reconstructive surgery, but I was ever so curious about the future. And there is no time like this present to be even more curious about what lies ahead. So I'm delighted to share with you my laser journey today. So in long short, I have left the NHS. I've been pursuing my new career in non-surgical medicine for 10 years. I'm delighted that Cynosure invited me to be their key opinion leader a few years ago, following the success of the Icon laser, which I introduced into my practice in 2016, and now followed by Picosecond 3 years later. I launched my own clinic 5 years ago in 2015 here in Beaconsfield in Buckinghamshire, and I have a wide array of advanced medical aesthetic treatments to treat the skin, face, and body, and lasers are a very, very key part of that. So this is my treatment portfolio. On the left, you have me operating and cutting. So that really was taken about 2009. And now if we fast track across to the middle and to the right, we're now live in my clinic. We do a lot of clinical photography. So I really put a strong emphasis on that. We have photography for the skin, face, and body, and lasers have become a really, really common part in my day-to-day practice here at the clinic. Where are we with the future? I think we would be denying our patients the right to treatments with low downtime, fast recovery, stealthy results. Before they even know it, they get results over time. So there is no better time to be in laser science, and the future really is in picosecond technology with Picosecond for advanced, refined skin revitalization. So I'm really excited to talk to you about this today. So we're going to touch through why I introduced lasers into my practice, and a really exciting part of all of this is the education. We're here educating ourselves, we're educating each other, and the most important person we should be educating is our patients. So with that in mind, we need to address them, educate them on the science of their own skin aging. I'll introduce you into the Picosecond technology, how that works, and we will also share together some results from colleagues from the Far East, as well as results of my own, which we've had in the clinic for the last 1 year. And I hope that you'll not only leave educated, but that you will feel inspired. And when I say inspired, why is that? I was really inspired in 2005 at the National Medical Laser Centre when I first learned about how advanced these lasers were. I'm still continuing to be inspired when I hear my colleagues present on laser technology, which is what brought me here today. And I hope that I continue to inspire you with the potential and the possibility of you taking these devices and learning about it, introducing it into your practices, and giving patients some fantastic results that I know you can deliver. So, where are we today? We are here with our aesthetic patients. And what are aesthetic patients interested in? They're interested in their aesthetics, whether it's from a functional recovery of the skin or an aesthetic recovery. They want one thing. They want a good result. They want a result that's going to make them look better, but more importantly, now it's all about the feeling better too. So when I think about what beauty stands for, it's a combination of so many things, whether it's the touch, something that looks nice, whether it's a color, something that smells good. But also when you look at this picture down before you, patients are interested in one thing more than ever now, themselves with that selfie camera. So we've got a lot to deliver. Beauty has transcended across time. And this is a very interesting picture because even back then, in the days of Cleopatra bathing in soured milk, and even to the Tupperware parties, where again it was all very topically driven, to the third picture, which again we're looking at gender neutral topical. So it's been topical, topical, topical. But then fast forward to the right, we've seen this huge transition, really looking at technology. Now patients are used to nowadays, they're used to having technology in our lives. We have it all around us. So it almost comes to a point where our patients are expecting us to have high impact technology, which is what something that they're used to receiving on a day-to-day basis right now. So when I look at my patient portfolio, my patient demographic, 5 years ago when I opened the clinic, I did not have any technology as much as I do right now because I've slowly evolved it over time. My patients would generally come to me for frown lines or other things like that. But when you look at the reality, this is what we're looking at. We have a patient with skin concerns. If we did one thing and neglected the rest of the face, we're doing our patients a huge amount of disservice. So we look, this is the reality, and this is what we need to address. So we know that when it comes to skin like that last patient, she's a good patient of mine, it can significantly influence and affect our self-esteem. And what do we mean by that? Loss of confidence, emotional downgrade, and now more than ever, we're spending increasingly much more time on our mobile phones, on our gadgets, especially now here in lockdown and beyond. We're going to be spending more time also with each other. We're looking at each other on our webinar screens, on our TV screens, and we're going to be wanting to look even better over time. So in terms of actually influence that, we have to understand even more, what does skin quality mean? When we talk about skin quality and we talk about good quality skin, we look at everything. We look at the color, we look at the texture, we look at the tone, we look at the smoothness, the resilience of it. And then we also look at one key thing that everybody is mentioning to me right now, hydration levels. How many of you out there have had patients say, doctor, dentist, my skin is feeling dry right now? Patients are going through increasing amounts of stress, releasing cortisol is producing a lot of influence over skin. So I think now more than ever, we have to understand what the impact of this situation is doing to skin quality so that when we do come out on the other side, we need to drive patients' results faster than ever. So that's why my Picosure is going to come in, hopefully when it's safe to do so, in high impact style to drive great skin health. I'll also mention the pathology, acne, rosacea, psoriasis. I'm not a dermatologist, but I think it's important to see that things like that do exist in our patients and we must correctly diagnose and identify. So what are we really looking at in terms of the key trends today? From skin revitalization, gone are the days where our patients used to be a little bit older. Now we're seeing something that I call prejuvenation. Younger patients becoming more aware now than ever against the benefits of preventative aging. And these are patients who are generally so used to being on their mobile phones or their devices, and they want and they desire to use things that are going to make them look and feel better much more quickly. So where is it am I heading to with this? If they are desiring high impact, high return, high performance results so they can feel better about themselves, we're not looking at a topic called anti-aging anymore. We're looking at dynamic aging. We're looking at aging positively, agelessness. So with that, we need to bring into our practices topicals, technologies, and treatment that are going to work in that direction. This is where Pico sits in beautifully for me now. We also see an increasing number of male patients. In my practice, we're predominantly 89% female, 11% male. However, that number has improved and increased over time. So we're seeing more patients coming in. Men are very driven by tech, so that's easy. And really, we're looking at patients with no time for downtime. Now more than ever, how many of you hear patients out there saying, I'm spending so much time on the internet and all of this, and I've got limited time for downtime? Think about what's going to happen when our clinics do reopen. It is going to be like that more than ever. So again, this is where my Pico is coming in, and I'm preparing all of my patients for that. We're also seeing a rising now aging population. Now that will naturally come with time because we have an older population that is actually looking after themselves much better medications. But the other thing that they also have is a curiosity where they may not have had treatments before. There is this curiosity about, why can't I have that? Why can't I try that? Somebody else is having it. So a lot of our patient demographics are 60 and above, and they're having treatments and technologies like this because they want to and they can. So in terms of the aesthetic journey, we talk about planning the treatment plan for our patients. And where it used to be maybe a slightly longer route, now we need to be able to show patients a shorter cut, and we need to drive it fast. So this is where we come in as practitioners, and we need to educate on the aging process. Many of you will be very familiar with our aging process slides divided into internal and external factors. So we know that 35%, let's say, is due to our own natural biological clock, our own genes, our own DNA. And the rest of it really is down to what we call all the other environmental factors. We know that UV damage is a significant contributor: cigarette smoking, alcohol consumption, glycation. On the left, we have pollution. Pollution has really come into play to play a significant part in accelerated aging. But now more than ever, stress. Stress has produced a high impact on the telomeres, and they cause those telomeres to shorten over a period of time, leading to causes of accelerated aging. And this is really what happens underneath the skin. We have changes with the skin, with soft tissue, and that doesn't make our patients feel very good. But the question is, we know so much about aging, and I can give a whole lecture on that, and we educate our patients on that. So can we actually tell our patients what's going to happen in their future aging pattern? The answer is we kind of can. And the way that I do that is we have a good detailed consultation. Consultation is key to really identify what your patient's concerns are, what their motivations for treatments, and also assessing the patient. And we do that with skin imaging as well as with touch. And with that, we can understand not just what's going on the surface of the skin, but what's going on subsurface. 5 years ago, when I looked at my Visioskin results, these were the key things that I identified: vascular concerns, pigment concerns, and textural concerns. So I knew that I had to bring in lasers at some point in my journey, and I did. So we started off with the icon technology, and we addressed facial redness, vascular concerns, and pigment changes in skin types 1 to 3 extremely well. We had results all the time. I would call icon a workhorse. And following in from that, we started to see increasingly more patients with a darker skin type, wanting skin revitalization, pigment concerns, and textural changes. So I knew I had to bring in something that was going to address that. So my question is, why laser? Why now? I love this slide. I'm a movie buff. You can see that is going to produce a result. That is going to hit the target. So we know industrial lasers hit a target and they destroy. It gets the job done. This is a movie from its 60s. Where are we now? We're in 2020. So we know that lasers have targets. We have hair removal lasers with melanin targets. We have lasers that target pigment, lasers that target vascular, and target water for skin revitalization. So with all that in mind, I set in place, we brought in the icon. And so that was the first lady I showed you. And look at her over time. We've blended it really beautifully with a combination of lasers, topicals, a little bit of toxin, and some filler. And if you see her, the emotional attribute of her face has gone from someone who is negative in energy to someone who's generally a lot more happier and in a better place with positive self-esteem. She looks healthy. She looks well. Then we look at the next patient, and this is where the confidence comes in with how to blend lasers into your clinical practice. Use it everywhere. Everyone deserves a right to have a laser treatment. So we target our patients first and foremost with the laser, 3 treatments, and then we run it through with toxin and fillers and everything else. And this is how they end up 6 to 12 months later. Everybody deserves to have a laser treatment, and that sits in every day in my practice. So here we are now. This is March the 16th last year, 2019, where we introduced Picosecond into the clinical space. This is my laser suite at the clinic. And why did I bring in? It was really because we were starting to see, we were starting to get success with our icon results. Our patients were delighted with it. And post-summer, patients were calling back. They wanted to get results. And I guess we started to get more and more requests from our darker skin type patients once they built more confidence in us. And they said, could that laser be suitable for me? And icon, as you know, is not ideal for a darker skin type, which is where Picosecond comes in. It's the world's first picosecond laser, so it works on a trillionth of a second. So we know that it's going to be good impact for someone with a darker skin type. It's also got its FDA approval, which I'll come on to next. And that is ideal to treat wrinkles, pigmented lesions, acne, scarring. And that was something I was looking for. It was originally created in 2012 to be a tattoo removal laser. I'll come on to that next. So whilst I haven't brought it in for tattoo removal, it has been now created as the laser of choice to treat tattoos that are difficult to completely finish off. And I'll go through the science. The science is, how I would say, inspiring. And I was very inspired by other presenters that I heard over the years. And for me, I was looking for a laser that was going to deliver skin revitalization for the skin, face, neck, as well as décolletage in the back of the hands. And not just to treat melanin and pigment, but to stimulate and rejuvenate skin over time. So this is why I brought it in. A little bit of science about the actual wavelength itself. So it's a 755 nanometer workstation, wavelength of light. And what I really want to bring into play is 2 things. So I want you to remember the 755 wavelength. I also want you to remember the focus length. And there's 2 components I'm going to come to next. And where it sits very nicely is treating wrinkles and textural concerns, skin types 1 to 4. But it's the next layer down, pigmented lesions for skin types 1 to 6, acne scars 1 to 6, tattoo removal 1 to 6. So we could use this potentially. One day I may decide to bring tattoo removal service into my clinic to create a treatment portfolio for a large number of patients at the practice. So with that in mind, we brought this in, and now we have to describe to a patient, why is this picosecond pulse important for you? It's important because that picosecond pulse works on a trillionth of a second, so it doesn't have enough time to get hot. So you don't get the thermal effect as you do with other lasers. You get something that is called a photoacoustic or a photomechanical impact, and that comes from the pressure wave technology of picosecond technology. If you have a look at the diagram compared to the other 2 lasers, the Q-switch and the YAG and the Q-switch Alex, one is 7 times shorter and the other one is 70 times shorter. So what does that mean? From a tattoo perspective, you can get the stubborn colors, recalcitrant tattoos, but also from a pigment point of view, it's going to shatter pigment without any collateral damage, or certainly with minimal collateral damage. So let's have a look at the histology. Let's see what happens. On the left, you've got untreated tissue. Look what happens with the Q-switch laser. You get these large vacuoles following the impact of the laser of the skin. If you look on the sides of the vacuole, you can see the pigment, but it's still not quite fragmented yet. Now go to the picosecond laser and look at it. Much more diffuse, much more high impactful. And if you look at the size of the vacuoles, they're much more fragmented. So it's a better picture, it's a better clearance. And you can actually see from this slide of the untreated tissue looks at the big pigment within a tattoo. You can see it's practically like rocks. Q-switch laser, you're shattering most of the rocks, leaving some pebbles with some sand behind. But if you look at the Picosecond laser, the picosecond technology fragments everything. And this is just with one pass of the 200 millijoules. And everything goes to sand. When that happens, what it means is that it can be much easily taken up by the lymphatic system, and the lymphatic system will take it all up and disperse it very quickly. This is a brilliant slide showing the 755 and its high absorption ratio of melanin to blood. So if you look in the middle, which is a 755, you've got a 50 times difference between your melanin and the wavelength. So you're going to get much less pinpoint bleeding. You're going to get a faster recovery time. You're going to get patients who have much less downtime compared to other technologies. And you're also going to have an increased amount of collagen and elastin production. So compared to the other two wavelengths, which are much more ideal potentially for tattoo removal and pigment, this one doesn't affect the capillaries. So you get a much faster recovery time. To keep it simple, we've got two hand pieces. You've got a zoom hand piece of 2 to 6 millimeters, and you've got a fixed hands piece, which I use a lot of in the clinic. That comes in an articulating arm. So in terms of learning how to use it, you have to kind of almost dance with this device. It's very interesting, but very easy to learn. So these are the two hand pieces again, fixed in the zoom. I'm going to quickly focus on them a little bit more. So this is your zoom hand piece. It twists and it goes up to 2 to 6 millimeters. So you just have a straight beam of light onto the skin. This is what I call your fixed hand piece. And your fixed hand piece comes in a 6, 8, and 10 millimeter spot size. And you have two types. You have a flat lens and you have a focus lens array. I would really like to focus on the focus lens array, pardon the pun, because this is really what I was looking for. High impact, low downtime, fast recovery, good quality results with pigment skin revitalization. So I'm going to focus on that predominantly today. So what happens with the light? You have this energy beam of light coming from the laser. If you look at the flat picture, flat lens on the left, it goes through the skin, through the DEJ, which is the dermo-epidermal junction, and it's good for deep pigment. But as you can see, you have to be mindful of darker skin types because you may have high risk of hyperpigmentation. So you have to use this one carefully. However, on the focus, you can see that laser is focus beam to the intraepidermal area. Nice and beautiful. What is it about the focus? You have one big beam. It fragments into about 100 micro lenses. So that's what you can see coming through. And that takes that energy and it microbeams it up to 20 times greater and delivers that to about 5% of tissue. So again, big beam of light, 100 micro lenses, 20 times greater fluence, 5% treatment area. Whilst at the same time, you have a background of lower fluence all around it. So that's why you get this high impact as well as you get skin revitalization throughout the whole area. What does that mean? Great for darker skin types, skin to be treated safely, higher and lower fluence all around. This is what it happens on the skin surface. So we're looking at 100% of energy, of which 70% is delivered in these microspots of high fluence and 30% of lower fluence. So you're getting a nice blend of both. And again, because you're only treating 5% or you're only getting 5% of that treatment area, you have to do multiple passes to get a good result. So this is what's going on underneath the skin. You can see very clearly, all localized to the intraepidermal area. That is what's going on. And it causes those little white shields, cause laser-induced optical breakdowns. What is that? It is a pressure wave. It is a pressure wave that's contained within the intraepidermal area. And that's what it looks like. LIOB is almost like a plasma ball. Safe, effective plasma ball. What is it? What it means is that this plasma ball that's created in the intraepidermal area is created by a bunch of lucky electrons, which are almost ejected by the melanin cells. The more LIOBs one creates during a treatment pass, the more electrons are growing there, creating an elegant injury to the skin. And this is where it gets beautiful. It stimulates your body's own natural healing responses. And the body has a unique way of communicating. Cells have a unique way of communicating with each other. We call that cell signaling. And when one cell tells another that it's going through an injury and it's not well, the whole thing shudders, and that's when you get this thunderbolt under the skin. And that's when you get collagen and elastin production by a repair process. And we get dermal remodeling. So this is what happens. You don't have any breaks in the epidermis. And if you look on the right, this is what happens just 10 minutes after the treatment. LIOB formation, 24 hours. And then after that, you start getting dermal inflammation. Don't forget, we didn't touch the dermis. The LIOBs are just within the intraepidermal area. And this is a beautiful histology slide by Dr. Emil Tanghetti, and it shows that there is no break in the epidermis, but you do have these LIOBs in the intraepidermal area. Very little inflammation initially. 10 minutes later, you're going to get these vacuoles forming within the skin. You're going to get pigment breakdown. And then over a period of time, you can see with the melanin staining, you're going to get intraepidermal necrosis. You're going to get pigment disruption. You're also going to get fast, effective recovery processes in the skin. Again, no vasculitis. There's been no thermal injury. There's some heat in the skin, but not to the impact, because this is photomechanical. This is photoacoustic. And junctional melanocytes not damaged as well. So that means your risk of developing post-inflammatory hyperpigmentation, it just does not happen. And this is what happens months after the treatment. So at the clinic, we've done 4 treatments, each back to back. We carry that out monthly, depending on the patient, depending on their indication. And we leave the patient alone, and we let that collagen produce, and you can see what happens to 6 months after 4 treatments. You get a much more a higher degree of improvement in elastin fibers. So what happens, and the difference between Picosure compared to your ablative lasers? Have a look. There is no disruption to the epidermal junction, the epidermal barrier. The skin is not pierced. So the elegant injury is limited to the epidermis. There is virtually no downtime. Compared to even the 1540, we see at least a 25% reduction in downtime compared to our previous 1540. No disrespect to the 1540. So this is what happens. We do a treatment, the patient is red immediately post-treatment, and then literally they go home, they call us back, most of it's gone, at least 50% is gone. We've also had patients go out now after their treatment because they're used to it. The next day everything's gone, they're back to work. And this is how it looks like compared with our predecessors. Again, no disrespect to the predecessors, everything has evolved over time. So when we look at traditional non-ablative, which is the middle slide, you can see there's a higher impact of downtime. Traditional fractionated CO2, much more downtime. Whilst if you look at the top Picosure, you're pretty much done and dusted in 24 hours post-treatment. I will touch on this very, very quickly, because out of respect of time, consultation really is key when it comes to laser treatments. Consultation is key with everything, but also with skin revitalization. Your patients have to commit to it. They need to understand, and we need to manage their expectations. If we don't give them an idea of what they could and should look like with what our expectations should be, then they must follow us on that journey as well. They must get excited about their results. I always say, think about what success looks like for their result and expect it. If you don't expect it, if you don't have hope, it's not the right treatment for you. We're not the right practitioner for you. Take consent. With consent, I will always talk about photography. Photography really is key, whether it's handheld photography or whether it's Visia digital skin analysis photography. Keep it consistent. We photograph all of our patients between every single treatment. Why? We want to show them the result, but most importantly, we want to see the result too. We want to learn. We want to see what every treatment can do. It will also keep you safe. It will keep your patients and your team safe. Prep your patients. So on that note, we never carry out a laser treatment on the same day as a consultation or on the same day as a booking. We just don't do that. We want to prep our patients, whether it's psychologically, emotionally, but we certainly want to prepare their skin. We want them to increase their water intake. We want to make sure they're not suntanned. We want to make sure they are well. And in terms of the treatment itself, I won't go into too much because the treatment training has been very straightforward and very easy with the clinical trainers from our Cynosure team and the guidelines. We pretty much follow the guidelines to get the type of results we get. I want to show you the spacer on the display screen because if you look on the spacer on the right, that's what the focused lens array shows you. It has 80,000 pulses on it and it counts down. So you could almost get to about 50 treatments per handpiece per patient. Patient comfort. Now, we generally apply topical anesthesia for our patients. We want them to be comfortable, but that said, the vast number of our patients now don't have topical anesthesia at all because they're used to having those procedures. We use cold air during the treatment. It keeps our patients comfortable, and the results really are very fast. Their downtime is quick. They return to work straight away the next day, and with a little bit of light makeup. We use a makeup called Oxygenetics, And we tell them that if you've had a little bit of darkening of the skin, that will shed off very, very quickly in a couple of days. And we reschedule their treatments all back to back on a monthly basis, up to 4, up to 6 treatments. Most patients don't feel the heat. I do find with my Oriental Asian patients, they come down very red. They come down red initially, and that goes down very quickly. We certainly don't get the edema and the swelling that we did with our former lasers, and we certainly get much more positive feedback faster with these type of results, with patients coming in saying, I want to have what my friends just had just there. So now onto the clinical results. On the left, we can see picosecond technology being used in the lower half of the picture. Have a look what happens 1 month after 3 treatments. We can see just a beautiful clearing of the tissue. And the important thing is there is no adverse effect. So there's no blistering, there's been no ulceration. We have good quality tissue, and we have skin revitalization. Again, these are results from other colleagues. These are not my pictures, but again, a beautiful clearance on what would otherwise be very hard to treat, deep pigment, very stubborn in nature as well. So you can see a beautiful clearance of the skin, but if you look at her forehead lines, they seem to have revitalized even further. Beautiful example of skin revitalization following acne scarring treatment, and you can see you just have this lifting of the tissue. Even the sleep lines are starting to get better. She looks like a much younger version of herself, and even around the temples, if you look at her pores, they look much more refined. Her eyes even look brighter, and the crow's feet lines are gone. So with this treatment, I always say to patients, it is not just going to target one thing. It is not just going to target your acne scars, your pigment. It's going to give you everything. It really is a treatment for you. Beautiful results. So these are from colleagues from the Far East, Dr. Shin, and this is a flat lens to treat a lentigo. And if you can see, this is not the focus, this is the flat lens, and this is where the beauty and the skill of a skilled practitioner to treat skin of color comes into play. A beautiful result just after 1 treatment. And I don't know many lasers that can give you results like this with no downtime and very little recovery. So beautiful result there. Here we have Amoeba sabota. It's a benign durable melanocytosis, which in the past you'd say would have been treated with a Q-switch and DIAG or maybe even a ruby laser. And you'd often need several treatments to clear a lesion like this to an acceptable level. But we've had recent publications from clinicians in Hunan in China, which can show a beautiful result just after 1 or 2 sessions using the 755. And this is a beautiful result. I've never seen results like this before. And when I saw our first presentations that I came across with Picoshow 2 years ago, I was very inspired. So I really look forward to learning more from our colleagues in the Far East. These are my results, and from my team too. So I want to thank them on that note. These are the type of patients we see in our practice every single day. Patient who's in their 30s and 40s, fit and well, just been out in the sun, been on a gap year. She's a personal trainer, so she's caught a lot of sun. The skin is red, the skin is pigmented, and she's aging a lot faster before her time. And this is someone who's now just had 2 Picoshow sessions. And I just want you to take note of her forehead lines and her textural lines. They're practically going, and this is just after 2 months after 2 sessions. If you look at her upper eyelid, crow's feet, you look at her pigment, but if you also look at the redness in her skin, everything seems to be settling. And there is a lot more clinical work going on from the States about cell signaling to upregulate collagen and elastin and downregulate all the things we don't want. So I think there is so much more to learn about this. Again, airbrushing of the skin, fine lines, redness, pigment reduction. If you look at the pigment on her right lower eyelid, again, that would have been otherwise stubborn to treat. She's over the moon. And her patients, or her clients, or her customers, where she's in business in, will generally tend to come into the clinic saying, I would like to have what she's had. Again, another patient, 46 years old, and she's only had 2 treatments. So this is her 2 months into the treatment. I want you to take note of her nasolabial folds. They look better. The skin just looks healthier. She's certainly tightening, and we've not done any injectables in her yet. So I feel that this is future generation for patients, even preconditioning of the skin as a whole, before, during, after injectable treatments is going to be a very, very commonplace in my practice. It already is. Great to show patients what happens underneath the skin. If you can demonstrate there is pigmentary changes, you can actually show patients that things are happening on a much more cellular level. My Asian patients, so again, this is someone with just up to one session. And I picked these slides specifically because I wanted to show you, if you show someone a positive result, tightening of the skin, refining of the pores, dampening down of the pigment, and a brighter skin after one treatment, they will be inclined to stay with you for a very long time. We treat a lot of décolletages, again, a nice removal, 3 sessions. But I want to show you in the next picture, look what happens with the textural changes in the neck. Beautiful revitalization. And this is somebody who's very heavily sun damaged. You can see patient in her 60s, 65-year-olds to be precise. This is my patient. And this is very hard to treat. And this is purely just Cynosure Picosure lasers. Recovery very fast. This is a patient when we treated who actually sent us the pictures. And this is very interesting about Picosure. Patients are really happy to show their result because they're excited with the fact that they didn't have the recovery time. But look at the pigment on the left cheek. Very stubborn, very deep. It gets darker and then it sheds off and it gets much lighter. Recovery is fast. I don't want to keep my lasers too separate because I love putting it all together. And just because I have one laser now, it doesn't mean the other one becomes negligent. I still use Icon every single day. However, this is a patient who's had Icon with me in the past, and we then gave her 1 Picosure treatment, and this is what she then looked at like on the right. So a lot of our patients are going to evolve from former laser treatment into what I call new generation. And they deserve to experience both. They deserve to really see what can happen over time. So this is her 4 years down the line. When she first came to me, the pigment on the left was incredibly extensive. I also wonder, will she be getting precancerous? These are things that we need to think about if we don't treat our patients with such extensive sun damage. And to be able to show somebody these type of cellular changes on the right is incredibly rewarding. So this is where we end up with, really. You've got the 755 nanometer. You've got this beautiful, elegant focus handpiece. It's producing light and taking it down to create pressure wave technology with an elegant injury intradermally. What does that do? It's localized in the epidermis, you have very little downtime, and it stimulates gene expression. There is cell signaling going on. You get collagen and elastin upregulation. You get breakdown in the melanin. And the clinical studies have shown that you have heat shock proteins that are upregulated, very similar to other ablative procedures, but just without the downtime. So I'm blown away by the presentations that I have heard by my colleagues in the Far East from the States. And there are publications every single year by my colleagues that present for Cynosure lasers with multiple abstracts at ASLMS. So if you need any further information on this, please reach out to our team here in the UK. They'll be really, really pleased to share all this information with you. I'm excited to be a part of that too. And so in summary, I hope that I've been able to inspire you with what I've been inspired with my laser service and my laser learning over the years. It really is that technology ideal for someone with no time for downtime. I don't think we should keep our patients in the dark anymore. We need to let them see the light, and we need to give them the opportunity to learn about these things. They can understand that with harnessing the light, we can stimulate cell signaling to give them better quality result over time. With no thermal effect, we can now treat a darker skin type safely, much more effectively. And we can now blend these treatments to incorporate into our patients' lifestyles very well. Ideal for a face, skin, neck, chest décolletage, where in the past I saw Picosure being top of what I call my treatment ladder. Now I see it being everywhere in my treatment ladder. So we do this very commonly in our practice. So on that note, I'd like to thank you all for your time and for listening. I'd really like to thank Cynosure for the opportunity as well. I wish you all the very best, everybody. Stay safe and stay well. I'd be delighted to take any questions now. Thank you.
Thanks very much, Sherina. I'm not sure, I've got a weird loading thing, so I'm not sure whether everyone can see me, but hopefully you can hear me. Thank you so much. That was really in-depth and really interesting. We've had a few questions come through. So first of all, someone has asked what is good for Asian Indian skin due to pigmentation and small dark marks from spots. So I'm guessing they mean like pigmentation from acne scarring as well. So in terms of perhaps your protocol with the laser, what would be good for a patient presenting with that?
Great question. So again, thank you. I would always go back to the consultation. So with the consultation, it's important to ascertain a couple of things. Are we looking at hormonal pigment? Are we looking at pigment due to sun exposure? Are we looking at pigment due to melasma, pregnancy? We need to establish what the trigger was, whether it's natural evolution or whether it was trigger induced. Then we're using the skin analysis, like the Vizia, we need to establish what layers are influenced as well. Are we looking at superficial? Are we looking at mid-depth? Are we looking at deep pigment? So it'll be very hard for me to say, oh, this is a one-size-fits-all. I think the beauty about whether it's topicals or technologies, everything needs to be very hyper-personalized. But what I would say about Picosure laser is, yes, it is ideal for my skin type. I come from Malaysia. I'm Sri Lankan in origin. Would I have a Picosure laser? Yes, I would. So now I finally have an opportunity to have a treatment with a laser in my own clinic, whereas I wouldn't have been able to with the 1540, with the 1540 and the Max G, which came with the icon. I hope that makes sense. So the answer is yes. If one had to choose a laser for darker skin types, this would be it.
Okay, brilliant. Thank you. Someone else has asked about the pros and cons between laser and IPL therapy. So the deciding factors of choosing one over another. Perhaps it's their first piece of equipment in this realm and they're trying to decide which to take on. What would your advice be around that?
Well, again, you need to decide. Gosh, that's a whole lecture in itself, really.
That's a big question, yeah.
But I think you need to look at your demographic. So when I opened, we had 0 patients, at all. And going back to that slide where I said, our patients presented with melanin changes, they presented with vascular concerns, textural concerns. So, we knew we needed something for melanin, water, and pigment. And at the time, our skin types were skin types 1 to 3. I didn't have many patients with a skin type darker if I had to look at the relative ratio. So it made sense for me to get an IPL type system. I really liked the Cynosure icon because it had that IPL and it had the 1540 fractionated. So guess what? I could do both. And that blend of Max G and 1540 is sublime. The results are sublime. Whereas now with the evolution of my practice, into its 4th and now its 5th year, we were getting more and more patients of a darker skin type. My skin type, full skin types fits 4 and beyond. That's where Picosure really comes into play now. Does that make sense? Yeah.
Thank you. Hopefully that answered the question. I think that's probably about all we've got time for now, actually. Do you want to just let people know where they can find you, perhaps on social media, if there's anything else that they'd like to talk to you about or to follow the clinic and your work?
Yeah, absolutely. My last slide actually had details to my Instagram account, which is S-Thetics_clinic. It'd be absolutely delightful to see you there. Alternatively, if you do go onto my website, S-Thetics.co.uk, and follow all the social media tabs through there, that would be great as well. But I do urge you, it's beautiful science. When I first heard the science behind Picosure technology, and this was actually about 3 years ago, it's nice to learn about what's out there. We shouldn't be kept in the dark and stick to chemical peels and do the same things over and over. Look into the light, look into the future, see what's available. I was blown away by the presentations, and you can't help but think, wow, here is something that can do something like that for somebody and for someone. And when I look now at the moms and patients that I have, and I look now at their children who are 15, 16, 17 coming up with their acne scarring, this is exactly the kind of technology that generation deserves to have. They deserve to have it. We shouldn't keep it in the dark anymore.
Wonderful. Well, thank you so much. That was great. And thank you everyone for joining us and for your questions. You know now where you can direct any further questions to Sherina or to get in touch with Cynosure if you want to talk about this platform specifically. Thank you for joining us. Thank you again, Sherina. That was great. And yes, we will see you all tomorrow for the 2nd day of our AM virtual event. Thanks, everyone. Bye.
Have a good day. Thank you.